Hi, it's Julien here with Steve. He's just been telling me he's got some right hip and right kind of QL flank stuff going on there. But interestingly, some stuff that might be cranial, might be jaw, so we'll check those. And definitely that relationship that is so often where you'll see some stuff going on in the jaw and skull, and then opposite hip and pelvis. And also we were talking about just doing some gastric and digestive chest as well, because you know, what did you say?
Back on the gluten.
Back on the gluten, indeed, and it'd be interesting to see if that comes up on it. So, right, up you jump, and we shall get stuck in. Steve, always good value for the 100% in it all the time, full on, whatever it is. Yeah. Okay. So, turn your head all the way to the right, all the way to the left, back to the centre. So initially it looked fairly level. It's just worth doing that head turn thing, that if there's going to be an obvious PD, it will bring it out. It does, makes it look more obviously on the right there. Steve is right PD. And see how he goes from short, comes up, and it definitely goes long on that right side. Yeah. Okay. Okay. To watch that in slow motion, maybe. I was trying to do it in slow motion there. So yeah, and Steve's a regular one for using a punch bag and doing martial arts training. And you right leg dominant, are you?
That goes a mix, but probably
Don't know what the phrase for regular and southpaw with legs is. I guess it does.
Don't know.
Yeah, good question, isn't it?
I think it stays the same.
Could be. Actually, Muhammad Ali documentary on telly last night. You see that? Have you seen that?
No.
Oh, great. The Sonny Liston fight. God, I've never actually seen it. Amazing. Yeah. Right hand up behind your back. Swap your hands around. Both hands up behind your back together, where he becomes world champion. Both back down by sides. L4 on the right. And Sonny Liston famously says at the end, he said, I don't know who this guy was who turned up. Wasn't the guy I thought I was going to fight, because this guy can punch. L4 on the right. Set your right hand up by your face. Big deep breath in. And out. Left hand up as well. And both back down by sides. 88 on the right. Just turn your head to the right. Lift the right shoulder off the couch, back down. Shrug both shoulders up to your ears and down. Squeeze the right elbow into your side and let go. Squeeze the left one in and let go. Shrug your shoulders up and roll them back. Head back into the centre. Right in the paper, we'll do that again in a minute. Okay, so we're getting a right medial, left lateral scapular pattern. And back up. Into the proximal distal metacarpals. Okay, let's turn your head to the right again. Shrug your shoulders up and roll them back. Head back into the centre. Lift up your head, back down. Suck your chin down to your chest, back to centre. C2 on the left. So earlier on, Steve was asking about, do you ever question or doubt? So when you did that C7 test, the first time you did it, because you were fighting the paper a bit, I went back and did it again because you just didn't quite do it smoothly. And I don't know if that's going to interrupt it, but it's not as it should be. So it's worth being fussy about these things, because sometimes you don't want to be missing things or picking up errors because it wasn't done quite correctly. Okay, stretch your right hand towards your right knee and back round. Left hand to left knee and back round. Okay, so I'm going to start with the left jaw and temporal. We'll check some cranials and then do that first and then recheck the pelvis. So bite teeth together nice and hard. And let go. Open mouth nice and wide. And let go. Okay, so there we go. So we've got some jaw stuff going on. So that's an anterior extension of the jaw. So if you turn your head to the left, so we get changing in position 1 and position 2 when he opened his mouth nice and wide. Find the gnashes, the teeth, come up to the angle of the jaw. I can actually feel how tight that is in there on your masector, and then set in one following the line of the jaw, head back into the centre. Definitely sensitive, isn't it? Yeah. Yep. So just for the camera, we'll recheck it. Open mouth nice and wide, let go. And that all looks good. TMJ attaches into the temporal, which in the activator protocol either side looks a forward, a rotation, or a posterior rotation. No, not getting either of those. Worth just checking the occipital, which can move lateral as well. So turn head left, push your right ear into the couch, and let go. Cool. Ready? Head back into the centre. So that is a left lateral occipital. So it's putting pressure on this side. It's putting pressure, compressing the temporal occipital junction. Find mastoid. Just come a little bit up, so you're off that suture and definitely onto the occipital, and it's a straight medial thrust. On setting 1. Okay. Again, for the camera, let's just retest that. So turn your head to the left, push right ear into the couch, and then go. Happy days. Sorry, just go back to do that again. Just go, so turn head left, push the ear into the couch, and then go and stay in that position, and just relax. Yeah, there we go. Head back into centre. Don't want, those are complaints that I didn't do it quite the same. There we go. Okay, so right hip and pelvis. So the other thing about it is to look for that internal external flare of the ilium. So stress testing it. That way that seems good. Right side of the pelvis, push it down into the couch and let go. Okay, there we go. So that is a right anterior pubic symphysis. Lucky you. There we go. Want to share with the world. Okay, over onto your back. There we go. We got about a billion responses, and then we've got to check out gastric one, haven't we? So we've done this adjustment before, haven't we?
Right pubic symphysis,
yeah, anterior. Okay, right. So there's always a couple of things worth saying in this one. Make sure they know what's coming up. The adjustment is on the right side, on the front aspect, the superior aspect of, so the anterior aspect of the pubic symphysis. In other words, it's right there. It is almost always going to be quite tender, and the only other thing that you can make good about it is to get in there and do it quickly. Find anterior superior iliac spine, so the knobbly bit here. follow that pelvis, like kind of mentally following the line of the pelvis until you find it there, tender onto it, 8 pounds of pressure, deliver the thrust, get out. Okay, cool. Good. So I just wanted to check that gastric one as well. So nice and level in the prone position there. Actually just putting some pressure on the left side down along there. Look for a change in leg length. Actually, no, leave it well alone. Cool, excellent. See you next time.
Thanks.